or sometime in their life. And the key certainly to fighting the disease is being aware and proactive. Next week, there's a forum where you can learn what you should know about breast cancer. Joining me this morning to talk more about your breast health is Dr. Shahla Masood with UF Health. Good morning to you. Thank you for being here. It's good to see you again. I do appreciate it. Can't say enough, certainly, about local efforts, obviously, to raise money to help with breast cancer research. But the reality is, when you get that diagnosis, your whole world, no doubt, is turned upside down. And it's important, 3 points. It's important, first of all, to understand that this is not a single disease.
Absolutely. One of the most important, really, recognition is breast cancer is, first of all, not a fatal disease in majority of the cases. We have breast cancers that they are low grade, and just a simple excision is sufficient for them, and they can stay under the care of their physicians, and they really have a normal life, and they can really enjoy their life. There are a small group of breast cancers that they're very aggressive, and we have all the means to recognize what kind of cancer a patient has. And these are the cancers that we put full attention to use every tool that we have to try to eradicate and try to really help the patient to increase their survival and their quality of life. But collectively, the notion that breast cancer is a fatal disease is no longer appropriate for a lot of breast cancers.
And that's an important point to remember also, which is why I think it's also equally important that when you're going to your doctor, to bring someone else with you who's actually listening to what the doctor is saying, because I think you have so much going through your mind, you're not really paying attention to some of the details. For example, making sure that you know what form, what kind of tumor you have.
Absolutely, absolutely. Understanding of what kind of tumor you have and having the right questions to ask is fundamental for treatment planning. And studies have shown that patients that they participate in their treatment planning and they are knowledgeable, they often choose a better option for their therapy, and the outcome is better.
Write those questions down before each appointment and make sure you have someone there to help you write the answers. I mean, I do that if I ever go to the doctor for my children. So let alone what it is that you're struggling with in terms of disease, it's an important point. And then third, and we hear this all the time, getting a second opinion, because different doctors have different, may have a different approach to how they would treat it, correct?
Well, two things that are very important. First of all, second opinion to make sure that the diagnosis of cancer is made right. There are many lookalikes in breast pathology that we see things under the microscope and they may look like cancer and they are not. So it's important for us to make sure that our slides and the pathology report is viewed one more time with another set of eyes so that we make sure that the patient has cancer. That's number one. Number two is they need to really understand what are their options for therapy. The issue is not who is right and who is wrong. Medicine is not a black and white, process. There is science and art in the process, and there are differences in opinion. And the best option is, first, know what kind of cancer you have. Secondly, understand what options are available to you. And then ask about the risks and benefits of each therapy. Because ultimately, you have to understand that every therapy that is being offered to the patient, they are associated with some side effects. So we have to balance it.
And it's interesting, too, because these are the kinds of issues that are going to be discussed during the public forum, which is next week. But if you want to attend, you need to certainly register today. Who is best to go to this public forum? Is it other doctors? Is it people who've been diagnosed with cancer?
Well, this forum has been designed, it's about 16 years now, to try to elevate the status of the knowledge of the community. Men, women, survivors, people that they take care of breast cancer patients, people that are at high risk, or anyone who wants to know something about breast health. And in that situation is a free dinner, is a question and answer. We have fantastic panel of experienced physicians involved in the process of responding to that. And we have some, prizes, door prizes, and so on and so forth. And the intention is to bring and elevate the breast health literacy to make people to become more aware of their breasts.
Free and open to the public. Thank you, Dr. Masood, for being here. I want to give everyone
Absolutely.
the phone number to dial to register, because you do need to register. So the breast cancer forum, as I mentioned, is next Wednesday. It runs from 5:30 to 9:30 in the evening. It'll be held at the Omni Jacksonville Hotel downtown. You must RSVP, as I mentioned, today by calling this number, 244-6069. Despite what it says there on your screen, it is today that you need to register, not by tomorrow. There will also be that raffle to win a $100 gift card to Ruth Chris. We will post this information on news4jax.com also in case you missed that number.